Coronary artery disease. Coronary artery disease, KD, occurs when cholesterol and plaque build up in the arteries, making them very narrow and restricting blood flow to the heart. With less oxygen reaching the heart, it has to work harder. At first, symptoms like chest pain, fatigue, and shortness of breath may come and go. But over time, the blockage gets worse, increasing the risk of a heart attack. People with this disease often experience symptoms when climbing up hills or stairs. They suddenly feel a slight tightness in their chest. At first, they might dismiss it, thinking it's nothing serious. But as the months go by, the discomfort lasts longer, and even simple activities leave them out of breath. This is how CAD gradually takes a toll. A well-known example is Dwight Eisenhower, the 34th U.S. president. Despite his strength as a leader, he faced serious heart problems due to CAD, experiencing multiple heart attacks. If left untreated, CAD weakens the heart, making every beat more difficult and putting a person's life at risk. Myocardial infarction. A myocardial infarction, more commonly known as a heart attack, occurs when a blockage in the coronary artery stops blood from reaching the heart. Without oxygen, heart muscle cells start to die. Some people feel intense chest pain, while others might only notice nausea or extreme fatigue. But no matter how it feels, the heart is being damaged. It often begins with a heavy pressure in the chest, like an unseen weight pressing down. The pain may spread to the arm, jaw, or back. Breathing becomes difficult, and a cold sweat appears. In that critical moment, every second counts. Popular singer and actress Debbie Reynolds suffered a fatal heart attack just one day after her daughter, Carrie Fisher, passed away. Stress, combined with underlying heart disease, played a role in her sudden cardiac event. Atrial fibrillation. Atrial fibrillation, AFib, is a condition where the heart's upper chambers, atria, beat irregularly and out of sync with the lower chambers. This affects blood flow and increases the risk of blood clots, stroke, and heart failure. Normally, the heart beats in a steady rhythm, but for someone with AFib, it can feel unpredictable, like a drum skipping beats or racing without warning. Even while sitting still, their heart might suddenly start pounding as if they've just run a marathon. Dizziness follows, and sometimes a sense of breathless panic. A famous example is former U.S. Vice President Dick Cheney, who has lived with AFib for years. Despite treatment, he needed multiple medical interventions to manage the condition. If left untreated, AFib can turn something as simple as a heartbeat into a serious health risk. Ventricular fibrillation. Ventricular fibrillation, VFIB, is a life-threatening condition where the heart's lower chambers, ventricles, beat in a fast, disorganized rhythm. Unlike atrial fibrillation, VFib causes the heart to stop pumping blood completely, leading to cardiac arrest. Without a defibrillator to restore normal rhythm, death can occur within minutes. It can happen without warning. One moment, everything seems fine. The next, the heart starts to malfunction, skipping instead of pumping. Blood flow stops, consciousness fades, and within seconds, the body collapses. Without immediate medical help, survival is unlikely. NFL player Damar Hamlin collapsed on the field in 2023 after suffering cardiac arrest, likely caused by VFib. Fortunately, quick medical intervention saved his life. Bear in mind that VFib doesn't offer second chances. It requires immediate treatment to restart the heart and prevent tragedy. Ventricular tachycardia. Ventricular tachycardia, VT, occurs when the heart's lower chambers, ventricles, send out rapid, abnormal electrical signals. If it lasts only a few seconds, it may cause palpitations. But if it continues too long, the heart struggles to pump blood, which can lead to collapse or even cardiac arrest. A healthy heart beats in a steady rhythm, but in VT it races uncontrollably, pounding too fast to circulate blood effectively. A person may feel their chest thudding, dizziness creeping in, or in severe cases, lose consciousness without warning. Some medical experts have debated whether VT played a role in the tragic passing of NASCAR legend Dale Earnhardt Sr. after his crash in 2001. While his injuries were the primary cause, there's speculation that an undetected heart condition, possibly VT, may have contributed. When the heart beats too fast for too long, it simply can't sustain life. In these moments, immediate medical intervention, often with a defibrillator, is the only way to bring the heart back to a safe rhythm. Dilated cardiomyopathy. Dilated cardiomyopathy develops when the heart muscle weakens, making it harder to pump blood efficiently. This condition can develop due to genetics, infections, or even excessive alcohol use. As the heart struggles, symptoms like fatigue, swelling, and breathlessness gradually appear, signaling that the body isn't getting the circulation it needs. A strong heart should contract with power, but in dilated cardiomyopathy, it weakens, like a stretched-out rubber band that has lost its elasticity. The heart enlarges, its walls thin, and each beat becomes less effective at moving blood forward. Over time, this strain can lead to serious complications, including heart failure. Barry White, the legendary soul singer known for his deep, soothing voice, battled dilated cardiomyopathy in his final years. The condition contributed to kidney failure and, eventually, his passing. Hypertrophic cardiomyopathy. Sometimes the heart works harder than it should. In hypertrophic cardiomyopathy, HCM, the heart muscle thickens, making it difficult to pump blood properly. Some people never notice symptoms, while others experience dizziness, breathlessness, or an irregular heartbeat. In some cases, HCM can lead to fainting, chest pain, or even sudden cardiac arrest, especially in young athletes. This condition is often genetic, causing the heart walls to grow too thick. As the muscle becomes stiffer, it disrupts normal blood flow and increases the risk of dangerous heart rhythms. A person might feel completely fine one moment, only to suddenly collapse the next. Hank Gathers, a talented basketball player, had HCM. During a game, his heart went into an abnormal rhythm, and he collapsed on the court. Despite his strength and athleticism, his heart struggled in ways no one could see. Restrictive cardiomyopathy. Restrictive cardiomyopathy is the rarest type of cardiomyopathy. It occurs when the heart's walls become stiff due to scarring or abnormal protein buildup. Unlike other heart conditions, the heart doesn't enlarge, but it struggles to fill with blood properly. Over time, fluid can build up in the legs, belly, and lungs, making even simple tasks feel exhausting. A healthy heart expands and contracts with ease, but in restrictive cardiomyopathy, it stiffens, like a balloon that won't fully inflate. Blood has trouble flowing in, leaving the person feeling constantly tired and short of breath. NFL player Reggie White suffered from a related condition, which contributed to his sudden passing. When the heart loses its flexibility, every heartbeat becomes a challenge, turning routine tasks into a struggle for air. Aortic stenosis. The heart is meant to pump blood smoothly, but in aortic stenosis, the aortic valve becomes too narrow, making it difficult for blood to flow out. It's like trying to force water through a clogged pipe. The heart has to work much harder to push blood forward. At first, the symptoms may go unnoticed, but over time, dizziness, chest pain, and extreme fatigue start to appear. Climbing stairs becomes exhausting, and even standing up too quickly can cause lightheadedness. As the valve narrows further, the heart struggles to keep up, and in severe cases, it can lead to heart failure. Bing Crosby, the legendary singer and actor, had aortic stenosis. He stayed active for much of his life, but the condition placed an increasing strain on his heart. Without treatment, aortic stenosis progressively worsens, making every heartbeat a challenge. Mitral valve regurgitation. The heart has valves that act like doors, opening and closing with each beat to keep blood moving in the right direction. But in mitral valve regurgitation, one of those valves, the mitral valve, doesn't close properly. Instead of flowing forward, some blood leaks backward, making the heart work harder to maintain circulation. At first, the leak may not cause any noticeable symptoms, but as it worsens, the heart starts to struggle. A person may feel constantly tired, short of breath, or experience a racing heartbeat. Even simple activities like walking or talking can become exhausting. Over time, the extra strain causes the heart to enlarge, increasing the risk of heart failure. Elizabeth Taylor, the iconic actress, lived with mitral valve regurgitation and eventually underwent surgery to repair the faulty valve. Without treatment, the condition puts growing pressure on the heart, making every beat a tough battle. Tetralogy of Fallot. Tetralogy of Fallot, TAF, is a rare congenital heart defect made up of 4 structural problems: a hole in the heart, a narrowed artery, a thickened heart muscle, and a misaligned aorta. These issues make it difficult for oxygen-rich blood to circulate properly, leading to episodes called blue spells, where a child may turn pale or struggle to breathe. Babies born with TOF often have a bluish tint to their skin due to low oxygen levels. Their small hearts work over time to push blood through the body, and as they grow, they may tire easily, gasp for air, or instinctively squat to improve circulation. Without treatment, the heart continues to struggle, making even basic activities difficult. Shaun White, the Olympic snowboarding champion, was born with TOF and underwent multiple heart surgeries as a child. With proper care, many TOF patients go on to thrive. But without intervention, the heart finds it difficult to deliver the oxygen the body needs. Coarctation of the aorta. Imagine a bent garden hose. Water can't flow through easily, and pressure builds up before the blockage. That's what happens in coarctation of the aorta, COA, a condition where the body's main artery is too narrow, making it difficult for blood to flow to the lower part of the body. The heart has to work harder to push blood through, but the restricted passage still slows circulation. Early on, there may be no noticeable symptoms, but over time, high blood pressure develops in the upper body, while the legs may feel cold, weak, or cramp easily. Some people experience frequent headaches, dizziness, or nosebleeds, while others don't discover the condition until serious complications like heart failure or stroke appear. Martina Navratilova, the legendary tennis champion, was diagnosed with COA as an adult. Despite her strength and athleticism, her heart had been working against hidden resistance. With surgery, the narrowing can be corrected, allowing blood to flow more freely. Endocarditis. Endocarditis is an infection that affects the inner lining of the heart. It usually occurs in people with existing heart conditions, artificial valves, or weakened immune systems. It often starts with flu-like symptoms, fever, chills, and muscle aches. But as the infection spreads, it can cause serious problems. Blood clots may break off, leading to strokes or organ damage. Without treatment, the infection can destroy heart valves, eventually causing heart failure. The heart is a powerful pump, but it's not immune to harm. In endocarditis, bacteria enter the bloodstream and stick to the heart's lining, forming infected clumps. What begins as mild symptoms can quickly become life-threatening if not treated in time. Composer Gustav Mahler suffered from endocarditis at a time when antibiotics didn't exist. Over time, his heart weakened and the disease took its toll. Today, with early diagnosis and strong antibiotics, endocarditis can be treated, but without care the infection can take over, making every heartbeat a struggle. Myocarditis. Myocarditis is inflammation of the heart muscle, usually caused by a viral infection. In an attempt to fight off the virus, the immune system sometimes attacks the heart by mistake. This weakens the heart's ability to pump blood, leading to chest pain, irregular heartbeats, and, in severe cases, heart failure. Some people recover completely, while others develop long-term heart issues. A young, healthy person might suddenly feel exhausted, short of breath, or notice their heart racing for no clear reason. At first, it might seem like just a bad flu, but beneath the surface, the heart muscle is struggling. Orson Welles, the legendary actor and filmmaker, suffered from myocarditis, which contributed to his declining health later in life. Because the early symptoms are often mild, many people don't realize something is wrong until serious complications arise. While some cases heal on their own, others need medical treatment to prevent permanent damage. Pericardial effusion. The heart sits inside a protective sac called the pericardium, which contains a small amount of fluid to prevent friction as the heart beats. But in pericardial effusion, too much fluid builds up in this space, putting pressure on the heart and making it harder to pump blood. At first, there may be no symptoms, but as the fluid increases, a person may feel short of breath, weak, or experience heavy pressure in the chest. If too much fluid collects too quickly, the heart becomes compressed, unable to expand properly, a dangerous condition called cardiac tamponade. Without urgent treatment, blood flow can stop completely. Tammy Wynette, the country music icon, suffered from pericardial effusion, which worsened her existing heart problems. In mild cases, medication can help, but severe effusions often require immediate drainage to relieve the pressure. Thank you for watching. If you enjoyed the video, please consider subscribing and liking the video. It helps us out a lot.